"Oh, what did he say? Who's that?" Clearly, I have a hearing problem. And so naturally, at some point, I'll go to my favorite doctor, Dr. Ovidio Pinish, a doctor of medical sciences, to ask him if I can't hear well anymore because of the headphones I've worn for so many years. For various reasons, is there a possibility to do something about it without necessarily going to the doctor?
Yes, of course, you still need to get a checkup at some point. Let's do that exactly, but we also need to do things at home, my dears, because we need this hearing for as long as possible. Yes, and I wish you to live past 100 years, so let's prevent now the hearing problems that develop over time. Unfortunately, these hearing issues are also emerging among young people. If you've already gone past 25 years old and through all your adolescence, or you head to the gym and put on your headphones to listen to music to get you pumped up and it feels great and you keep those headphones on, you'll already begin to experience problems.
So there are many hearing problems in this period, and you will understand that, well, you'll lose your hearing.
The fewer sound inputs you have, just like with your vision, the less information the brain receives and it tends to atrophy. So there's a very clear connection established between hearing acuity and intelligence and the overall functioning of the brain, and conversely, when the brain degrades, so does hearing. And so, since hearing is so important, we are interested in stimulating it. As you know, it's primarily through the ear, but our ear's anatomy isn't just what's visible externally. So this outer ear, it's merely a funnel designed to capture sounds. These sounds obviously then travel through this auditory canal, this tube. Yes, and you can see that there's a membrane, and that is the eardrum. It vibrates just like a disc because of the sound, and then it moves a whole series of tiny bones there, all of which means that the outer ear must be fully functional and well vascularized. Once it's here, the cilia and temperature, everything is important in this tube, până pe la 2 hours, and there should be no obstacles, no blockages, no specific issues, and then the eardrum must function well, not be inflamed and not be ruptured. And those little bones, so that there are no inflammations there. And then the blood vessels that irrigate this entire very complex system. You see, it's delicate, it involves so many things, and any vascular problem can affect our hearing and even more the nervous system. From these tiny bones, some receptors there in a small cochlea, which then send signals to some neurons. So all those tiny bones, but everything is based on the nervous system. So the neurons also have to process it. If these neurons also have a problem, it's the same. So you see that problems can arise at various levels. And so the first thing you can do is don't stay in noisy places. The more you expose yourself to sounds that are louder and louder, young people go to clubs, to discos. Well, now, in the recent period, people don't really go out much.
We will get out someday.
They will go out again, yes. They expose themselves at stadiums. They expose themselves at the movie theater.
Do you recommend some earplugs if you sense the storm is brewing?
Yes, I just said to be very careful, because if, for example, you're speaking in a whisper, that's approximately 30 decibels. If you're having a normal conversation, like the one we're having right now, it's around 60 decibels. The traffic is already around 80 hours, exceeding 80 decibels, yet the maximum permissible for these things to function is around 85 decibels. All studies show this. Now, consider that the noise of just one motorcycle is already 90 plus decibels. Nah? If you're listening to music through headphones, you've already gone past 100 decibels. And if you go to see a plane taking off, it's 120. So just imagine at the cinema or a nightclub, when it vibrates, your entire body vibrates with that sound. Everything is just blasting. It's really intense. You shouldn't expose yourself to that. So if you're doing this, you must step out of there every now and then and not remain for more than 15 minutes when exposed to such loud noises.
You hear poorly when you go out, and you hear less.
When you step outside, you hear buzzing, you go into a quiet place for a moment, and sometimes you might even experience balance issues, because the ear plays a crucial role in regulating our sense of balance. But more often you'll perceive all sorts of sounds like crackling or various background noises that sometimes don't disappear for many, many days. So the second thing is this, headphones. Especially the headphones that we insert deep into the auditory canal, as we call it. We put them right into our ears, and because you want to block out all the noise from outside, you turn them up to maximum, if possible, even beyond maximum, right? And then these can easily exceed 120 decibels. Normally, you shouldn't even listen for more than 15 minutes at such intensity. Lower the volume, preferably use these large noise-canceling headphones.
Outside.
Outside, why? Because they attenuate the noise from outside, and then you don't have to turn the volume up to maximum, and you can leave the volume at minimum. You'll eventually find that you have applications on these more modern phones, and they even show you decibel limits for your ear health. So please do this to somewhat limit this problem. And even if you're using good, proper headphones at the correct volume, you shouldn't exceed 1 hour. So it's preferable that within an hour you take off your headphones and then you wait for about 15 minutes to let everything air out, to truly relax yourself, to hear the silence, as the saying goes, and allow all these internal gears and mechanisms to fully reset and recover. Protect your hearing just the same when you go, as I was saying, to concerts in loud places where you can't do much, you're just there, or at the cinema for action films. That's why you went. You've seen chairs are booming, right? You get some special earplugs for noise reduction, and DJs have them, and people who go to clubs and so on, you just put them in your ears and wear them. You'll hear very well. It won't distort the sound. There are numerous models to choose from. You'll surely find something that fits you perfectly, and you'll have them right there in a small box in your pocket, and you'll keep them safe, and you've put your entire hearing system under full protection because it won't. Anyway, if you've gone to a party like that, or you're in a deafening noise, or you're in Nisaya, or you're working, step outside every 15 minutes, take a 10-minute break from those loud sounds, and after an evening of such auditory excess for at least 18-20 hours, preferably a full 24 hours, you should stay somewhere in complete silence so that your entire system can fully recover. Blood vessels must pump blood well there into the ear so they don't clog, so they function, dilate, and bring oxygen, bring nutrients. That's why cardio exercise is very useful. The thing you can do for your hearing, especially if it has begun to weaken, is to incorporate cardio exercises into your daily routine. Go for a short run, at least for 30 minutes. It stimulates. Do some push-ups. So if you maintain this for approximately 30 minutes daily, it gets the blood circulating and fully dilates all the vascularization within the ear. This way you will function extremely well. You stimulate your heart, you stimulate the ear's vascularization, and everything will be just fine. Train your brain. Why did we say there's a connection between the brain, neurons, and the ear, right? How do you do it? You have him do sports, lift weights, so it's very useful, for example, to stimulate hearing. Turn on the TV, let it play at normal volume, and try to talk with the people in the house and focus. This is a first exercise you can do. You focus on what people at the table are saying, letting other voices, music, or something else play in the background. This will be one initial exercise. For another exercise, you can cover your eyes, yes? Especially if you've noticed that your hearing has gotten weaker. You cover your eyes and ask someone to move to various places within the room to change their position and create various subtle sounds, different ones, okay?
Yes.
And you need to play with that person and recognize the sound. It's the rustle of papers. It's a banknote. Nah, you might even recognize its value. This way, the brain trains itself and all damaged neural pathways are forced to reconnect.
He's trying to get back to himself.
To reconnect with others, to rebuild the circuits, for other neurons to relearn, to take over this function and help you. Another thing, stay in silence, perhaps in a relaxing position, alone at home like yoga, and you'll see that yoga is very good too. And with your eyes closed, you start to identify a fly's buzzing there, a transformer that hums like that, so very faint noises, and try to recognize them. After that, like 15-20 minutes, then you go and check. That was it, that was the noise. And do this constantly, and you'll see that by training your hearing, you start to improve it, even if it has declined. And speaking of yoga, these relaxing positions are all sorts of positions. Don't you want to run? I mean, it's very hard to run, and you don't feel like it. Go ahead and choose a few of these positions. There are all sorts of names for them. We don't even want to get into them, but they work your entire body. You'll maintain a certain level of tension. Others you'll see are with your head upside down. They stimulate blood flow. They also stimulate your control and your balance and everything else. Change your diet. If you consume too much saturated fat, those tiny vessels will become clogged. So fried foods and all animal fats will clog the vessels in your ears, impairing your hearing. Therefore, choose omega, choose fish, choose fruits and vegetables.
As we always discuss, my essential and recurring question is, how do we properly clean our ears?
Dotaka in our ear canal, we have sebum that normally protects against bacteria, infections, and everything. Sometimes it can accumulate, especially if you keep headphones inside, right? Then earwax plugs form. Now, don't start cleaning your ears with those cotton swabs. It's the most dangerous because those swabs stimulate even more secretion and push the earwax plug deeper. So you wash with saline solution, you wash with water, you clean only the exterior, and preferably if a plug has remained in the ear canal, let's go to an ENT specialist, to the ENT doctor.
It's a very enjoyable operation, yes.
Let's get a lavage. Yes, it's an immediate shower, it's immediately flushed out, and everything gets cleaned.
And you feel you hear 10 times better than before.
Hear better.
Many thanks to Dr. Romulus Fenesh, Doctor of Medical Sciences and